Good morning, Dr. Davies. Do you have a moment? I wanted to briefly discuss an observation from the surgical ward.
Good morning, Mihira. Of course, what's on your mind?
Well, we've had a few instances this week where postoperative pain management protocols aren't being followed as consistently as we'd like. Patients are reporting higher pain scores than anticipated, even with prescribed analgesia. This isn't across the board, mind you, and we've ruled out issues with medication availability or administration errors by the nursing staff. We also had a minor incident yesterday with a missing consent form for a relatively routine procedure, though that was quickly rectified. The core issue, however, appears to stem from a lack of clarity in some of the postoperative orders regarding PRN pain medication dosages and frequency, particularly for patients undergoing more complex abdominal surgeries. It seems there's ambiguity in the parameters for escalation, leading to nurses being hesitant to administer additional doses without explicit clarification.
I see. So it's not a reluctance to give medication, but rather an uncertainty about the precise parameters for increasing it?
Nurses are frequently calling registrars for clarification, which delays patient comfort. This ambiguity is creating hesitancy, causing the lag in effective pain control.
Mihira, now that your surgery is complete, our main focus is on helping you heal comfortably and safely at home. I want to walk you through the key parts of your recovery so you know exactly what to expect. To manage any discomfort, it's very important to take your pain medication exactly as prescribed. Don't wait for the pain to become severe. Staying ahead of it will make your recovery much smoother and allow you to rest properly. Rest is a crucial part of healing. When you sleep or are lying down, please try to keep your head elevated with an extra pillow. This simple step helps to significantly reduce swelling and promotes better drainage, which will make you feel more comfortable. For the care of your nose, we will rely on gentle nasal saline rinses. These are not medicated. They are a mild saltwater solution that works to gently flush away any crusting and keep the surgical area clean and moist, which is essential for optimal healing. It is very important to avoid any strenuous activity or heavy lifting for the next 2 to 3 weeks. This includes things like vigorous exercise or carrying heavy groceries. Your body needs all its energy directed toward healing, and straining can increase swelling and even cause bleeding. Finally, even if you feel the urge, please do not blow your nose. If you need to sneeze, try to do so with your mouth open to relieve the pressure gently. I know this might feel like a lot of information, but following these steps carefully is the best way to ensure a smooth and successful recovery. We are here to support you through every step of this process.